Hi, my name is Kristen Maloney, and this is my presentation on telehealth resources in according to the Telehealth Resource Centers. So I started off with choosing the state of Arizona, which is my home state, and they are part of a group called the Southwest Regional Telehealth Center. And this group of telehealth resources represents several states across the Southwest. And the resources on their website include a range of things, but a couple of things to specifically highlight are a lot of online educational videos, resources on national and regional billing guides. There's a national provider directory to search for telehealth providers across the United States. There is a digital health navigators toolkit and some other resources for digital health navigation. This was unique, and I wanted to flag this to explain it further. So, digital health navigators, and according to the website, are individuals who address the whole digital inclusion process. So, connectivity, devices, and digital skills to support community members and provide access to healthcare. The digital health navigator model draws from volunteers, librarians, social services, or healthcare staff who offer remote and in person guidance to providers offering telehealth. And then finally, something cool that I found on this resource website is there is a patient tool to find telehealth using a specific map. So they can click on their state and search that way. So it's a little bit more patient friendly than the provider directory. And then we were asked to compare the resources on our primary choice of resource center website to three other states. And so the first state that I chose to look at was California. They have their own telehealth resource center just for the state of California. And some of the similarities I found on this resource website include a course finder for online learning and, again, educational videos. There are references to state and federal legislative and reimbursement policies, much like the Arizona Resource Center. And there is an online events calendar as well. Some of the key differences I noticed here were the patient resources included a search tool to look for telehealth providers by insurance plan. I thought that was really useful and practical for patients, and it allows them to look using an additional filter on insurance. There's also some resources for specifically using telehealth for remote patient monitoring. There's a whole section just on remote patient monitoring. And then there's a lot of provider resources. I mean, in general, this site is very robust. And within the provider resources, there are a range of implementation tools, including resources to guide providers on reimbursement from CMS and guidance from CMS on telehealth. There are rural telehealth resources, and there is a tool to search for telehealth workshops near you. The next state I chose was the state of Oregon, and Oregon is part of the Northwest Regional TRC, which represents actually 7 states. And some of the similarities are, again, they have like a map feature to find telehealth near you, but it's just specifically to your state, doesn't include your insurance provider. And then they also, again, have online educational resources and training. Some key differences I found here was it's pretty cool. They have a YouTube channel and also podcasts, something that I didn't see Arizona having, and something called Project ECHO, which stands for Extension for Community Healthcare Outcomes. And this brings specialists to general practitioners to help treat complex cases. So essentially, the website says that ECHO connects primary care providers with specialists for live weekly video teleconferences. And these 1 hour virtual clinics give the primary care physicians real-time reviews of these complex cases with specialists, and then also the specialists provide written treatment recommendations back to the primary care providers. So it's a way of bringing specialty care to the family and general practitioner space for patients. So very cool. And the last thing I noticed unique on the Northwest Regional site is that they do host their own conference. And so there was information on the site about this conference that they hold for NRTRC. Finally, I chose to look at the state of Texas, which is paired with Louisiana in the Texla TRC. Similarities to some of the other sites include that, again, there were resources there for billing, reimbursement, and just telehealth implementation. And there is a service provider directory, but interestingly, it links back to a directory that was created by the University of Arizona Health Services as part of the Arizona telemedicine program. And so they're the ones that support this page, and it provides a national search so you can search for any state. But I just thought that was an interesting link between, what these other TRCs are using back to something built by Arizona. And then differences again. So this site also participates in Project Echo. They also have some good patient FAQ resources, and they have some guides for clinicians to various video platforms. So, for example, DoxyMe, some of these different sites that telehealth can be conducted over. The practice might want resources on how to use the various ones or how to select a preferred one for their practice. So I thought that was a cool differentiator with Texas. And so all these sites have, some type of resources in the form of like fact sheets, FAQs, and toolkits for implementing telehealth and getting reimbursed. Again, as I mentioned before, Project Echo is offered both in the Texla TRC and the Northwest Regional TRCs. Texla and California as well had focuses on rural telehealth. And California generally just has the most robust collection of resources on their site when compared back to the other states, in Arizona is my reference state. And these are my references for the telehealth resource centers. So there's a main site and then the references for the 4 other states. And with that, I will close and say thank you for listening. And I hope that you were able to gain some insights into some various states' resources on telehealth. Thank you.